Mr. Lopez's acute cognitive changes and decline in physical functioning may be due to dehydration, due to his confusion, lethargy, headache, tachycardia, and feeling dizzy. His age and decreased thirst, as well as his frailty and suffering from comorbidities, which include congestive heart failure, hypertension, coronary artery disease, diabetes mellitus, and unspecified abnormalities of gait and mobility. His reduced exercise intolerance, mobility impairments, as well as polypharmacy, which is especially relevant for Mr. Lopez since he is taking diuretics. So some questions that I would ask Mrs. Lopez would include the following. Has Mr. Lopez had diarrhea, vomiting, or a fever in the past 3 days since I've seen him? I could ask her, what has his diet been like? How much water has he been drinking, if he's been drinking any water? Has he been taking his medications, or has there been a change in medication because he could have seen the doctor? And then I would also want to ask Mr. Lopez if it's possible what color his urine is or has been in the past 3 days, and how many times a day or night does he use the restroom. If not, I could ask Mrs. Lopez and maybe get an answer from her. So there are several tests and measures that I would perform with Mr. Lopez. I would check his urine first off, his urine color, and with dehydration, so I would expect it to be like a dark orange, like a dark yellow orange, because the kidneys are trying to save as much water as they can, and which concentrates the urine. I would take his vitals, especially his blood pressure, because I would expect it to be low. If the body doesn't have enough water, then the blood volume will also drop. I would want to put him on a scale and weigh him, and I would get the original weight from Mrs. Lopez, and then I would compare, and I should see a drop in weight. I would check skin turgor, so I would probably see an increase in the time the skin stays pinched like this to determine if he is dehydrated. I could test to see if he experiences orthostatic hypotension by having him lay down flat just for a little while, and then have him sit up, and I would ask him if he experiences any lightheadedness, dizziness. I would physically check to see if he is experiencing any of those things, and then check his vitals to confirm or deny orthostatic hypotension. I could check to see if he is alert to person, place, time, and then also re-administer the MOCA exam. And I would expect to see a decline in cognition from the initial evaluation MOCA results. I could also check his mouth to see if his mouth is dry. I would see the inner cheeks are dry and rough versus being like moist and shiny. So the diagnostic test I would recommend to screen for dehydration would be, for dehydration and electrolyte balance, would be a urine gravity test, which what that does is it compares the density of urine with the density of water to help identify dehydration. And I would also recommend blood samples to check the electrolyte levels, especially sodium and potassium.